a difference a year makes, from Boris the Brexiteer to the pandemic Prime Minister. 12 months after he entered number 10, and this unapologetic libertarian has presided over one of the most interventionist governments the country has ever seen.
To stay at home.
And today, news of another intervention, tougher measures to tackle obesity.
Now, I'm not normally a believer in nannying or bossying type of politics, but the reality is that obesity is one of the real comorbidity factors. It's losing weight is frankly one of the ways that you can reduce your own risks. Hello, Marina.
It's not just a policy shift, though, it's personal. When the Prime Minister was hospitalised with coronavirus, he weighed 17 stone.
I'm on the way. I've lost about a stone and a bit.
A very different Boris Johnson to the one who said this in 2006.
I am fat.
You're not fat.
I am fat. No, I think the word fat has... We're in danger of airbrushing the word fat out of the English language.
But today, the serious business of government, as he promoted a wider plan to prevent a second wave of COVID-19, a huge rollout of the flu vaccine to include all over 50s, people who are shielding, and some school children. These measures will sit alongside the plans to tackle obesity. We'll get the details next week, but under consideration: a ban on online ads for unhealthy food, a 9 p.m. watershed on TV ads, restrictions on in-store promotions, and calorie labelling on restaurant menus.
I think we all like to think that we have got responsibility for what we put in our mouths, but the truth is that we are influenced by so many factors to do with price and accessibility and appealingness of food as well, and the advertising industry and also the heavy promotions you see in store are just part of those as well. I think Boris Johnson has had to make some very tough decisions recently, and some of them have been quite unpopular, and I think what he needs to recognise is to have the best effect, you really need to take a strong line.
Earlier this month, the Chancellor was urging the nation to eat out. Now diners might be faced with calorie counts on their menus, and for people recovering from eating disorders, that's a big concern.
I'm 11 years into my recovery from anorexia, an illness that hospitalised me. And whilst I'm in such a good space with it, I know that this kind of messaging would be really, really damaging to me, but also to millions of other people.
Many of the measures are aimed at reducing childhood obesity, but do parents support them?
Especially if they're younger, it's difficult for them to understand why they shouldn't have it. So I think it's a good idea.
So do you think to some extent it's up to the parents, really?
Yeah. And your lifestyle choices.
Also sceptical, to say the least, is the head of the Food and Drink Federation.
Don't you think that it's important?
Obesity is very important and we should be tackling it. But if the government is saying this is about preparing for a second wave, I can't see how any of this is going to be in place in time to make a difference this year. And actually what we should be really focusing on is people's exercise, people's lifestyle.
We've got a plan to slim down the public from a slimmed down Prime Minister. A year into his premiership, COVID-19 has changed him as it has the nation. With both still recovering, we don't know yet what the lasting impact will be.
Liz Bates reporting, and this evening the Welsh Government has also announced an expansion to their flu vaccine programme and hope to include the over 50s and households of those who are shielding. Well, we're joined now by the chef and food writer Thomasina Myers, who co-founded the Oaxaca Restaurant Group and has campaigned for a healthy eating strategy. So obviously you think it is the government's job to be doing this. From this leak, does it sound like they're on the right lines?
I think it's a brilliant start. I mean, we know that that food businesses spend about £140 million a year on pushing pushing junk food to us. And of course, we're susceptible to it. Junk food is designed to taste good. You know, it's full of fat and sugar, salt, all the things that our body craves, all the things that we evolved not having very much of in nature. And so stuff that we really jump on when it's there in front of us. So, you know, they've designed these brilliant, foodstuffs that taste amazing, highly addictive, but of course they're highly processed too. And we now know that they cause, diet-related illness and death. There are now more deaths caused by diet-related illness than caused by tobacco or alcohol. And that's a big issue.
But their priority and immediate priority is clearly to just get people slimmed down because of coronavirus. So is it right for now, in the short term, to focus on calories?
So I think there's different things that the government's trying to do, aren't there? So one of them is this watershed moment, 9 o'clock, not advertising junk food. And I think that's really great because, we don't need any more encouragement to eat the food that's killing us because it's everywhere. It's at, eye level for children. It's in all the shops and we can eat it whenever we want. And it's affordable. So any move that kind of helps to put any barriers between eating that food because in this country, let's face it, we eat more ultra processed food than any other country in Europe, and we have the highest obesity rates, and those obesity rates are costing the NHS £10 billion every year. So if the government can funnel some of that money into tackling health, and I think there's so many other measures you can do, like in schools really promoting healthy eating. I mean, the food standards in schools really need to be updated. And any call to not only update
your own restaurants?
What about the restaurants? Well,
are you happy to put calories on the menus?
I think you have to be quite careful about, is this going to be a blanket thing across all restaurants? If you're working in a small independent restaurant, you've already been hit by a massive impact on your bottom line. If you're changing your menu twice a day, once a week, there is no way you'll be able to keep up with calorie counting all the time. There's the other thing about the joy of eating. So, for instance, in Oaxaca, we eat loads of avocados. They are full of fat, but it's good fats. They're full of nutrients. They're really good for you, but they're high in calories. Calorie counting is quite a blunt tool. Imagine, for instance, our street food menu is 50% vegetarian. That is really good for you. It's high in fibre. We know that we don't eat enough fibre in this country anymore. Eating more fibre equals good health. So say, if you started labelling restaurants for how many vegetables they have on their menu, what proportion of your menu is vegetarian? I think that'd be a great move.
I can see the Food and Drink Federation saying, oh, well, she likes rules for us, but not for her.
No, I'm not against rules at all. I just think calorie counting is quite a blunt tool because calories are not bad. We all need calories to eat. So, there are good calories and bad calories, but a calorie per se is not a bad thing. And I think you are stigmatizing food and making it the enemy. We heard from the anorexic girl. We don't want people to just think that food is the enemy and that any kind of energy and calorie is a bad thing. Calories we need to survive, and food is a great thing. It's whether it's healthy food and good food and so the calorie counting is difficult.
Thomasina Myers, thank you very much for joining us.
Okay, thank you.